The following program does not necessarily represent the views and opinions of Reality Radio 101, its advertisers and sponsors, or its listening audience. Listener discretion is advised. Good afternoon and welcome to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, where mind, mood, and what matters to you are discussed. We're broadcasting live from Toronto, Ontario, Canada. Send us an email right now. Our email address is instudio101@gmail.com. And now, right to your host of the Bear Psychology Radio Show, Dr. Anna Baranowski.
Hi, everyone. I'm so glad to be back with you here again today as we are bearing witness to evolving mind, mood, health. I am so excited because today we're going to focus on something that is very, very much in the news, and that is psychedelic assisted therapies for resistant mental health symptoms and pain as well. We are very fortunate to have Jonathan Sabbagh, who is the co-founder and CEO of Journey Clinical, and he is a mental health practitioner, but also very involved in bringing forward Ketamine Assisted Psychotherapy. And this is an area that is, I think in some ways it's controversial, but it's also a very, very needed element. We're in Canada and it's very hard for people to access psychedelic assisted therapies of any kind, either that they are extremely expensive or the only place that people can get access to this is a kind of like not quite professional access. So it can be very scary and people don't feel ready to take that on. And I really encourage people to do things in a way that feels safe and therapeutic, because sometimes things can go very badly. But, with this new field that is emerging in the psychedelic assisted therapies, there's so much going on. And I want you to feel comfortable to email us at instudio101@gmail.com if you have any questions while we're going through our conversation today. I know that it's an area I'm very interested in. This whole issue around what happens to your brain when you're on ketamine and, what this whole area of psychedelics is about. It's just very interesting because it has a huge potential to treat a very broad range of mental health illnesses and disturbances. And as I said before, including pain syndromes that are chronic. And people are finding that it has led to some very rapid results. When you're in the depths of depression or your PTSD symptoms are so severe that you just cannot make it through a day without your symptoms taking over the flow of your life. You definitely want to be thinking outside of the box as to different approaches that might be helpful for you as an individual. So today we have, as I said, Jonathan Sabbagh. Thank you very much for joining us, Jonathan, and welcome to the show.
Thank you very much for having me, Anne. It's a pleasure to be here.
Great. So today, what we're going to do is really just jump into this whole area of work. And, I know that you have done some of your own personal work because that's what brought you into a knowledge of ketamine and ketamine treatment as an option, and other psychedelic work, and led you to build Journey Clinical, I believe, as well. So maybe you could tell us a little bit about your professional background and how you went from, I guess, being in financial services, I think, and then into your own kind of self care, and then working into this new company that you built.
Yeah, sure.
That's a lot to cover.
That's a lot to cover. Yeah,
I
of
know.
course. Yeah. So, I am actually originally Swiss, and so is my wife and co-founder. And I spent the bulk of my career really working in finance, in hedge funds in various roles. And I actually was lucky enough to build two businesses while I was doing that function. But as I built the first one, I actually suffered a very substantial burnout. And that turned out to be the result of undiagnosed complex post-traumatic stress disorder. And I really had spent most of my adult life and part of my teenage years battling depression and addiction and taking a lot of medication. And it was really a daily struggle that led me to that point of just breaking. And about 7 years ago, I was actually, I don't know if it's fortunate or these things happen because you call them into your life, but a friend of mine introduced me to traditional ayahuasca ceremonies. I had my first ceremony at that time, and then I did 7 more in the space of 2 weeks, and I've completed more than 20 of them by now. And then I started also working with Ketamine Assisted Psychotherapy, and experiencing those modalities, I can say saved my life. I normalized my substance use. I lived a much more integrative life. I was also very blessed to work with a very qualified therapist who was accompanying me through this process. And, it actually prompted me to start to question a sense of purpose in my life of what I was doing on a daily basis and feeling connected to the work I was doing. And I just couldn't feel that anymore working in finance. And so I actually decided at the age of 38 to quit finance and go back to school, get my GED because I hadn't gotten a GED until then, and then come in as a undergrad in clinical psychology at the New School here in New York. And when I was, working towards getting my clinical psychology degree, I actually just got it. I had just gotten into the bachelor master's program. I felt the need that I wanted to integrate my background as an entrepreneur with my long-term goal of being a psychedelic therapist, and that's how Journey came to be. And I coerced my wife into joining me in this adventure as well.
Wow. Well, that is a very interesting pivot in life. It must have been scary to make that kind of pivot because it sounds like you were established already by 38 in the work that you were doing. Like, where did the courage come from?
My wife quoted Ram Dass about surrender, and I think this is it's a good way to explain it. I don't think, when Ram Dass said you don't surrender because, you choose to surrender, you surrender because you don't have a choice. And I think that's what happened to me. I was at a point in my life where I was at a downward spiral. Things weren't working out the way I wanted them to. I wasn't succeeding. I wasn't happy. And so, I don't think I had a choice. I mean, I chose to live and be happy and change my story. And that's what happened.
Mm-hmm. Wow. Okay. So I always find that really quite profound. I hear it from a lot of people, when there's this kind of, but I can't do it, like holding on with everything to a life that we knew that fit with, it kind of checked the boxes, it fit a certain pathway that we thought we had to do. And then there's this massive pivot. And though those pivots tend to kind of express a kind of a peeling back of our layers, and an allowance to be more authentically who we really are. And I find that takes enormous courage, not an easy step. So that's pretty impressive. I'm going to go straight to a question, because this
Sure.
is where we really need to start. This comes from Gail, and Gail says, by the way, Gail, thank you for the question, because it's exactly where we need to start. And Gail says, hello, Doctor and Jonathan. What exactly is ketamine?
Sure.
That's where we need to start, right?
Yeah, absolutely. I think it would be
Okay.
we can talk about what is ketamine, and we can talk about also how we work to deliver it. So ketamine is a dissociative anesthetic that was approved by the FDA in the 70s. It's very commonly used in hospitals as an anesthetic. It's also on the WHO list of required medication. Historically, ketamine has been used in ERs to treat people who have high suicidality. And there was research in Russia by a gentleman called Evgeny Krupitsky, who started to treat people with high alcoholism with intramuscular injections of ketamine, as well as combined with psychotherapy. And it was quite successful. It was brought over to the US. And then over the recent years, people have started to use ketamine as a treatment for anxiety and depression. And the results have been extremely impressive. So if you look at people who are treatment resistant, which is roughly 30% of the population, when you have people, for example, who are depressed, who are treatment resistant for depression, if they do IV infusions of ketamine, within the first infusions, about 60% of that population becomes respondent, and that lasts for over 3 months. So it's very, very potent. Obviously, it scales down, but it remains, right? So it's very, very potent, very fast acting. And then just in terms of the neurology of ketamine, so ketamine is an antagonist to the NMDA receptors in the brain. And so there's a theory called the glutamate theory of depression. And it argues that poor regulation of the neurotransmitter glutamate in the central nervous system is one of the physiological causes of depression. And so the receptors that receive glutamate are the NMDA receptors. And basically, ketamine is when antagonism to a neuroreceptor is almost like, think about a key that locks a door. That's what it does. It locks that receptor. And then the neurotransmitter glutamate is reabsorbed, and that regulates it. And that's what ketamine does. It also increases neural plasticity, which is really interesting because that allows you to learn and has that window of neural plasticity, which is roughly 7 days after the ketamine is absorbed. And there's various ways of absorbing ketamine, which I'll list. So that allows for a lot of work to come through and a lot of insights to be integrated when this happens. And in terms of the approaches to ketamine, so there's the medical model, which is IV infusions. And then this ketamine assisted psychotherapy, which is what we at Journey Clinical support. And the difference is that the medical model will only work with the drug itself in the context of the neurological interactions that I've just listed, whereas ketamine assisted psychotherapy will assume that the dissociative aspect, or what you may call the trip, as well as the insights that occur while under the influence of ketamine, can be combined with psychotherapy. And usually there's a model where there is a preparation session where people get ready to do the dosing session. They have the dosing session, and then there's several integration sessions to take the insights that occur during that situation and help promote long-term behavioral changes. And to finish off, there is a few routes of administration of ketamine. So there's IV infusions, intramuscular injections, nasal, intranasal, and sublingual. And the difference is bioavailability. And so, in IV is 100%, IM is about 98%, intranasal is roughly 50%, and sublingual, depending on if you spit or swallow it, is between 10 and 20%. And so sublingual and intranasal can be done at home, whereas IV and IM need to be done in the presence of a medical professional.
Right. Yeah. Well, so those are all really important things for us to discuss, because some of the approaches make it, well, financially almost impossible for most people, whereas the nasal or the sublingual or lozenge approach opened the door to a broad community of people who might benefit from this approach. I want to go back to a couple of things that you said, and this includes the glutamate theory of depression, which I'm questioning myself, because there are some current research studies that are looking at whether, let's say, these theories of depression as a chemical root are really accurate. So, a lot of people take SSRIs, serotonin reuptake inhibitors, and the idea is that you want to have serotonin more active in the brain, and that will help to regulate the depression. But there's research looking at many studies of serotonin, for example. I'm going to bring this back to glutamate in a minute. This idea of serotonin, using the same idea of a lock and key of the NMDA receptors that you discussed with glutamate. The question is really, what other elements are creating depression? And I think more in terms of how complex we are as human beings, and this idea of like just keeping glutamate, as a neurotransmitter regulated, or serotonin regulated, may be problematic. But I love the idea of ketamine as a softening and an element that may allow for an increased capacity for neuroplasticity, or more simply put, we are more receptive. We're more able to change and grow. The areas in our life that we are rigidly hanging on to become softened with approaches like ketamine or other psychedelic approaches. And during that window that you were saying, around 7 days, where there's an increased capacity for neuroplasticity, we're better able to work more deeply with the areas that we feel rigidly connected with. Oh, I have to be like this. No, I can only do that. No, I can't change in this way. I must continue doing all these, juggling all the balls that I juggle. And it's like the idea that there could be a way to get access to and increase neuroplasticity is very, very exciting. Mm-hmm. So, I mean, to me, it seems like anything that could do that for a person could open up a huge possibility for growth and change. I mean, you probably have seen this. I mean, you saw it with yourself. You got to a point in your life where you were in so much pain that you had to change. Like, that was a very neuroplastic point in your life, not because it was pleasant, but because you really had to.
Yeah. I think those are very important, valid points that you're bringing forward. Of course, there's the medical model, which focuses on that NMDA antagonist property of the drug, as well as the neuroplasticity, but really mostly the antagonism to NMDA receptors. And then there's the CAP approach, and that's what we support at Journey Clinical. And I think you're right. If you look at neurons of people who are highly traumatized or stressed, they're actually like there's very little neuroplasticity. And it's amazing actually to look at neurons. If you look at pictures of neurons before and after someone has taken ketamine, and you can actually see like the neural pathways form, and it's pretty amazing. So definitely using those in the context of psychotherapy is what we feel is really the best path to do it. And actually, just to give you an idea, like what we looked at when we were building Journey Clinical was that, we try, what we want to do is support mainstream adoption of psychedelic therapies. And we feel that, um, the medical model is one thing, but actually supporting the integration of these therapies as an adjunct to therapy for licensed mental health professionals is really the best way to do it, because the therapeutic alliance that therapists have with their patients is actually the safest and the most efficacious container to do so. And that's really where using that neuroplasticity can be leveraged, right? And so that's really the core of our offering. And so that's what we looked at, and we looked at how can people incorporate it, and this limitation, because as you know, a little bit on your end, partnering with doctors and finding them to essentially allow you to incorporate these treatments and to prescribe for you can be limiting. And so that's what we did. We've basically set up all the infrastructure for them to partner with us. We have a telehealth platform, and we take on the medical aspect while the therapists take on the psychotherapy. And then we have a whole online infrastructure with education and support and community. And so that allows our therapists to really work with their patients to leverage not only the dosing session, but the preparation session and all the integration work. And that's really, if you look at psychedelic assisted psychotherapy models, that's where actually long-term behavioral change occurs. It's when you start to integrate the insights that happen during these sessions.
Right. And they're definitely going to integrate insights better if there is this neuroplasticity, this ability to grow and learn and shift and let go of some of the kind of places where we feel that if we change, we will literally die, or, certain kinds of changes in life can make us feel that way. Like, it's like, oh my God, this is just really going to kill me. This is too much. And so as soon as we get to this place where we're, I can shift around that. I can soften around this. I don't have to force myself to, I don't know, finish graduate school in 2 years or something, like I can take my time. It'll be okay. Like it's fine. Just this ability to let ourselves say, I don't have to follow the rules so rigidly. So, we're going to go back to the questions, because we're getting some very interesting questions as we go along. Now, this one is really something that we have to discuss. This one's from Erica. Erica, thank you so much for your question. Erica says, hello, very interesting show today. Isn't ketamine an anesthetic, and is it dangerous? And, Erica, the question is perfect, because ketamine is actually an interesting anesthetic. It is an anesthetic, but the thing that makes it so much safer than most anesthetics is that it doesn't have the same tendency to depress the nervous system. And that's what makes anesthetics really dangerous. Jonathan, can you talk a little bit about that?
Sure. So that's correct. Ketamine is a dissociative anesthetic. The propensity for overdose in ketamine is it's very high. It's very hard to overdose on ketamine. There've been occurrences where people have mistakenly administered ketamine and actually added a 0 to the dose. So it was maybe 1,000 times more than what should have occurred, and people have recovered. So it's an extremely safe drug. That being said, there are counterindications, and that's important to note that ketamine is not a solution for everyone. And so, people, for example, who suffer from cystitis are not necessarily candidates. Increased blood pressure can be a concern. Pressure in the eyes can be a concern. People who are manic might not be eligible for these treatments. People who have personality disorders like schizophrenia, for example, might not be matching. So, and then there is a risk of people abusing it as well. And that's why we do it in a controlled setting where we support a collaborative care model, where we have frequent interactions with the patient, where we have the therapist check in with us. Making sure that is really supportive is very important. Otherwise, you can have negative outcomes as well. So it's very safe. But it has to be considered to be a drug that's taken into a controlled setting with an established infrastructure for that.
Jonathan, I'm actually curious about something you just said now regarding the potential dangers for these populations. I'm thinking particularly about the IV or IM versus the nasal or sublingual or lozenge approaches, and whether the research has gone granular with that, particularly relating to the risk factors when you have a much lower dosage or lower uptake of the medication.
Could you elaborate on that a little bit?
Yeah, sorry about that. So let's say you've got somebody who has a history of bipolar disorder with psychosis, and you're worried about administering ketamine, but you're choosing to provide the ketamine via like a lozenge approach, which is very low uptake. Has the research shown that it might be safe to use lozenge, but not safe to use the intravenous, something like that? That's what I mean by granular, like when it says it's unsafe, but through what method of administration?
Yeah, I don't think that, I mean, I'm not aware of any research that has singled out a route of administration versus an approach. So I don't, it's a question of bioavailability again, right? So, and it's not necessarily that, it might be, I don't know. I don't have the exact answer, but I'm not aware of a higher dose being more problematic to someone who's manic. So just for context, people who are in bipolar depression are absolutely eligible for ketamine. It's actually a very effective treatment. Someone who's schizophrenic, might go and have an episode because of the ketamine itself. So it's hard to assess exactly what dose would do it. Also, it's important to understand how sublingual ketamine works. The way you take sublingual ketamine is that you put it into your tongue, it dissolves, and you swish it in your mouth for something between 7 to 15 minutes, depending on the indications that you receive. And so the bioavailability can actually vary, right? So we've got our approach, for example, we have people come back for dose adjustments after 2 sessions because we want to see how they react for the first 2 sessions, and then we adjust it. So, in that context, it can be that someone has no reaction for 1 session and has a very big reaction at another session. And so that's why when we do screening for eligibility, it's by condition, and it's through a very thorough 1-hour intake with an experienced and trained prescriber who is able to assess if that patient is eligible for this. And then on top of that, because our members are licensed medical professionals, the dynamic is that they become members of Journey, they refer their patients to us, and we take on that medical part. And so there's an ongoing collaborative care communication. So if we're able to together assess if that patient is if it's the right time to do it. So and of course, just to be clear, all medical decisions are done by our medical staff. So the psychotherapist cannot make a decision on eligibility or dosing or frequency. But let's say that there's a patient who is bipolar and they're going through a manic episode, like we're definitely not going to necessarily want to work with that. But if someone who's having a bipolar depression, that could be something that could be eligible. So that's why blanket treatment of people is not a good idea, right? You need to have a container that allows for assessing if these patients are eligible for these treatments. And then the other part of that is understanding, being able to have a full medical history. So another thing we do is, let's say someone has increased blood pressure. Well, we'll reach out to their cardiologist or their doctor, and we'll make sure that, this could really work. And we make sure that they take their blood pressure before and after. But to come back to your question, like, is there a difference in having an IM injection or a lozenge? It's dose dependent, probably, right? You could probably go very high on a lozenge, right, and reach a similar bioavailability than you could on an IM. The IM, the difference really is how fast you get to peak and with an injection, right? So if you get an IM injection of 100 milligrams of ketamine or something like 70 milligrams of ketamine, you're at peak in less than 5 minutes, whereas it takes about 20 minutes to get there with a sublingual administration. So those dynamics and the experience is a little bit different, but I'm not sure that it would impact someone with schizophrenia more negatively if it was sublingual or if it was IM.
Yeah, I am wondering about those different methods of transmission, and I know the research is not quite there at this point. Everything is so new that there are a lot of different things that are being looked at, and including ways to supply these medications that do not have a psychedelic element. And I'm just wondering what you think about providing ketamine but turning off the psychedelic element of it, and whether you think that may lose the effect,
it's
the
a
beneficial effect.
Yeah, it's a great question. There's a big debate about this in the space, about the non-psychedelic psychedelics, and simply sort of carving out the trip and having people only, have the neurological benefits of it. And so there's two schools of thought, and I mean, there's probably a middle ground here, where some feel that, very much, if you consider what I was explaining when I was talking about the medical model of ketamine versus ketamine assisted psychotherapy, people who follow the medical model believed actually that the psychedelic or dissociative aspects, as they call it, are not beneficial to the patient. They could even be negative. Whereas people who are offering ketamine assisted psychotherapy are actually focusing on the dissociative aspect of ketamine to help generate insights. Similarly, people who are creating compounds that are non-psychedelic psychedelics feel like this is the most scalable way to administer them, and removing the trip, so to speak, or the journey, or the dissociative aspect, if you want to call it that way, is what they're targeting, right? And so there's benefits. There's some benefits to that approach. One of them is that it does allow populations who are non-eligible for these treatments to access some of the benefits of them. It's maybe easier it's easier to send as a pill to people, I suppose, and doesn't take as much time. The downside is that, as you're pointing out, the psychedelic aspect of or the journey that you get from psychedelics, which I personally believe has tremendous value, is removed. And so it's not psychedelic assisted psychotherapy. It's not a psychedelic journey. It's a medication. So I think there's both schools of thought, and probably room, honestly, for both to exist in the future. And we're likely not aware of which compounds are going to be dominating or going to be the most distributed, and in all likelihood they haven't been invented yet. But in our model, eventually probably we'll work with all of them, because that's what we offer, right? We offer access to psychedelics within the context of psychedelic assisted psychotherapy. And so, there's a possibility for us at Journey Clinical to work with all of these compounds.
Yeah, I mean, it really is a whole, a field that is just moving forward in leaps and bounds. In Toronto, where I am right now, one of the hospitals was just given a major grant to study psilocybin non-psychoactive versus active. And I don't know what their outcome is going to be, but I think it's going to be a 2-year study. And so, they're really pouring in a lot of research dollars into it to basically ask that question. And I agree. I mean, it seems like a very interesting question. I'm sure that there will be people who could argue both sides. So we'll see how it goes. Here's an interesting question. This is from Nancy. Thank you, Nancy. Hi, Dr. Baranowski. Isn't ketamine the date rape drug. And I'm passing that right over to you, Jonathan.
If I'm not mistaken, the date rape drug was GHB, but I know that ketamine has been used in a party setting for a long time. It's a little bit notorious for that, and people have been going into K-holes and abusing that drug. And like all drugs, it can be abused. That being said, the context in which we're discussing it and using it here is within the context of ketamine assisted psychotherapy. That means that a patient goes through a full intake, that these patients are usually suffering from anxiety or depression. They're at least in Journey Clinical's model, paired with one of our member licensed medical professionals. And so, we will only work in that context. We're not sending ketamine to anybody. We're really supporting the ketamine assisted psychotherapy model. And so this is a medicalized approach to treatment, which combines a drug as well as psychotherapy.
Just over a month ago, I had my appendix removed, and I previously, several months previously, I had an acute appendicitis, and it's very serious, right? And you're like in very extreme pain, and for the very first time in my life, I had hydromorphone, and it's very clear to me how easy it would be for somebody to become addicted to that, and any drug can be used for good, or could be misused. And so I really want to encourage people to really understand the value of these medications within the right context. But certainly, anything could be misused. I mean, these are very, very significant medications that we're discussing today. So, we want to put them in the right context and use them in the right way. Here's another interesting question. This is from Kelly, and Kelly says, hello, is this drug a narcotic, and is it available by prescription only? Thank you very much, Jonathan.
Yeah, thank you. So it is a narcotic. It's a Schedule 3 drug in America. I'm not sure if it's scheduling in Canada. Mm-hmm. And it is available by prescription only. The way it's prescribed is either for, so maybe just to give you a little bit of context on label and off label prescription. On label prescription is, well, as the name implies, is prescribed for what the label dictates. So if someone prescribes ketamine as an anesthetic, that's on label prescription of ketamine. When you're prescribing ketamine for the treatment of depression and anxiety, for example, you're doing an off-label prescription of ketamine. So just to give you a similarity, imagine someone tells you to take aspirins because you have, you need to liquefy your blood because you have clogged arteries. Well, that's an off-label use of aspirins. And so roughly 20% of all prescriptions in America are off-label prescriptions. But it is definitely something that has to be prescribed by a medical professional based on a diagnosis. This is not something you can purchase over the counter.
Right. And that would be actually exactly the same in Canada, everything that you just said. And ketamine is used off-label, and it is being prescribed in Canada. However, I have to tell you, it is very, very difficult for people to get access to ketamine outside of private clinics, where I think the entry level with something like Spravato, which is the nasal spray, and that is on label, because Spravato, which is S-ketamine, has been slightly changed molecularly, allowing for some research and also on label for use in treatment-resistant depression. And the starting is between $700 and $900 for one application. So it's quite expensive, and most insurance companies will not cover it. Some do, but it's hard to get it. And ketamine is not an expensive drug. I just want to let people know ketamine is not expensive. It's very, very cheap drug. But, in order for, us to get access to something like Spravato, which had a molecule change or a chemical change, it makes it possible for, a lab to do all the research and package it and, sell it for an amount that makes it worth their effort. But it's an expensive route. Right now, ketamine can only be prescribed off-label other than Spravato in Canada, and it is being prescribed, but it's hard to get it. I want to hear your thoughts on that, why it's so hard to get access to it, and what your vision is, Jonathan, because this is an area that you're doing that is very unique to Journey Clinical. Can you talk a little bit about that? Because that's part of the reason that I was so interested in what your company is doing.
Yeah, sure. Thank you for that. I mean, so on Spravato, I think that, Spravato gets knocked a lot, but it's, I think, important to note that it was a major change in the FDA's approach to basically psychedelic drugs to approve Spravato in 2019 for the treatment of anxiety and depression. That was a big milestone for the psychedelic industry. And so, the regulators move slowly, and it's a process, and you're looking to change a system and either reschedule drugs or bring in new ones or have new applications for existing drugs. So these things take time, and having them not only approve, Spravato as a treatment for anxiety and depression, but give breakthrough status for Psilocybin and MDMA is actually pretty amazing if you think about that. And even the willingness of, the DEA to collaborate with organizations like MAPS and start to deschedule. And these are amazing times we're living in. But that being said, you're right. It does limit accessibility, and it is expensive. And so, what really is going on is that most psychotherapists refer out, right? So as I was saying, it's very hard to get partnerships with doctors, or I'm not sure in Canada how it works, but here, therapists could try to find a doctor to partner with. We only have actually 25,000 psychiatrists in America, if you imagine that. They're mostly in large cities. So people even in more rural areas are quite limited. And then, these relationships are hard to maintain. They can be expensive on the patient. They limit the ability for the therapist to make money. And so even there, they're mostly referring out. And when they refer out to a clinic or a ketamine company that does direct to consumer offering, really they're foregoing all that revenue that they could have by building their own practice and incorporating ketamine assisted psychotherapy, not only to improve outcomes, but to grow their business. And so what our vision really is that, they pay us a small monthly fee, but they have access to a full medical team. They have access to training. They have access to community offerings that we support them really actually in legal way, like legal documents. It's very, very robust, our offering. And we have almost 400 people in our network now. And it's amazing because they're able to build out their own business, work with patients that are stuck and have been stuck for quite some time, and really have, we have such amazing testimonials on a regular basis of members who start to work with their patients in various modalities, in person and remote, in group cap. We've started to see things happen. So it's really been an awesome experience to work with them. And our vision is that this is a modality just like EMDR, right? At some point you're in your practice and you think, well, maybe now it's time to do, some psychedelic assisted psychotherapy, work with ketamine, just like you would say, well, maybe, we're not having success right now in our therapy. Maybe we could introduce a little bit of CAP, or, like you would use EMDR. And so that's it. It's that. And that to us actually is mainstream adoption. It's not flooding the market with ketamine to everybody. It's actually enabling therapists to incorporate these treatments in their practice as an adjunct to therapy for the long term. It's normalizing the incorporation of these treatments and having this be a standardized modality. That's what we're working on at Journey.
I love that. And there is a need for that, because it's hard to build that out on your own as an individual clinician or within a clinic. Like I have a busy clinic, and I like the idea of being able to add something like this, but boy, what infrastructure needs to be put in place to make sure that it can be handled safely and ethically, that you have enough support to do this in a way that, allows somebody in their own practice to do it reasonably. So it's a kind of exciting offering that you have. I know you're not offering it yet in Canada, but we are going to bring you here, Jonathan.
Yeah, that sounds
we talked about that. Here's another question. And this one is something that I think we need to talk about a little bit. So the question is, hi today, doctors. This is from Henry, and he says, is it also an anesthesia? Yes, it is definitely. And then Henry says, or just for pain. But let's just talk about the pain element, because, this is an area that's actually very interesting, and it's a growing area. This idea that ketamine can be used for people who have, serious pain, chronic conditions like ankylosing spondylitis, or Crohn's disease, or conditions that people are living with, fibromyalgia, where it's a day-to-day kind of journey of pain, chronic headaches, things that are making your life difficult every single day. So can you talk to me a little bit about what you're seeing with your pain patients?
Yeah, sure. So, I mean, I'm not a pain doctor, so I am not the best person to answer this. And our medical director, Kyle Lapidus, who is an MD, PhD, would definitely have a better way to answer these questions than me. But I am, and we don't really work that much with pain. We mostly work with anxiety and depression. But there's definitely a use case for example, a lot of people with neuropathic pain have found that ketamine infusions, or I don't know what I don't have the right answer about sublingual ketamine, so I'm not going to say anything that's wrong. But ketamine generally does seem to work for people with neuropathic pain. It could be a treatment for pain for sure. But then, I'm going to stop here because I'm not a pain expert and I don't know enough about the subject to give a great answer on it.
Yeah, so it's a tricky question. I have a number of patients who are on receiving ketamine treatments who have very complex pain histories and having some positive results, but it's really too small of a sample. I mean, I also cannot comment specifically. I've just heard very good things from a small number of people. This is from Dan, who is asking, Dr. Baranowski, is this drug available here in Canada? Thank you. Yes, Dan, absolutely. It is available. There are companies like Field Trip that offer it in Canada, and there are a small number of practitioners, some in the Toronto area, who are offering ketamine assisted psychotherapy. So definitely, but the numbers are small and the costs are high, and hopefully we can get to a point where the numbers are high and the cost is manageable, or it's covered with insurance. So we'll keep you updated on that. And maybe at some point, Jonathan will come back online with us and talk a little bit more about that. Sure. We have a couple of more, and I do want to get to those as well. This is a really interesting one. I don't actually know exactly. This is from Francis. This one is for you, Jonathan. Is ketamine a synthetic drug or a natural substance that is grown? It's definitely not grown.
It's not grown, yeah.
Talk to us about that, Jonathan.
Yeah, I mean, let's talk a little bit about synthetic and natural, right? Synthetic is natural as well because there are drugs that are in nature anyway, and things are synthesized. So I always have a bit of qualms with that dynamic. That being said, ketamine is made in a lab. It's definitely a synthetic drug. It's not like fungi or other compounds that are found in nature. But then psilocybin is synthesized, but it also exists in mushrooms, right? So that's something to think about. And by the way, the reason why I have some qualms with that that thought is that the need to have only natural drugs sometimes have made the use of certain psychedelic drugs unsustainable. An example of that is 5-MeO DMT and the toad, and that population is of toad is being decimated because some people feel that they really need to have the natural experience of the toad, whereas 5-MeO DMT can be very simply synthesized in a lab and very, very effectively done so, and it's exactly the same compound. So I do want to bring that up because it's important. Sometimes we have an idea that it's not good because it's not coming from nature, but maybe if we really want to respect nature, in certain contexts, it's important to consider not to use those resources or abuse them or deplete them too much.
That is a really, really good point. And, another support for medications like ketamine and the use of that as well. I'm going to read something from a Globe and Mail article. This is published in March of 2022. And it's really interesting perspective. This is related to somebody who's used ketamine. The first time Julian Uzeli took ketamine, he did not have visions or travel to new realms of existence. But the second, third, fourth, fifth, and sixth times he took the psychoactive drug, his consciousness seemed to spring loose from his body. His thoughts were shaped by the soothing music flowing through headphones. One time he found himself slaying demons inside the first-person shooter game Doom. I'm actually in my soul right now, Uzeli thought. These are my demons, and I have to slay my own demons. On another occasion, Uzeli's mind turned to BoJack Horseman, the titular character of the animated Netflix series in a self-destructive broken man. Well, anthropomorphic horse, to be accurate. I have a choice to be different from him, Uzeli told him later. I'm going to engage with my issues, and I'm not going to push people away. After ketamine's afterglow, these insights are almost embarrassing for Uzeli to talk about. But in the moment, he says, every revelation felt profound. More important, the experience helped him relieve his suicidal thoughts. And that's where ketamine's promise lies. So I'm reading that because it's such an interesting expose of somebody who's having a real-time and very beneficial experience, breaking down that ego structure as well. Your thoughts about this, Jonathan?
It's really amazing. Thank you for sharing that. It's actually a really beautiful way to express one's journey and how that feels. I mean, and it's so personal, right? So, I mean, there's a lot I can say about this. I can say that, on the topic of ketamine, ketamine is a dissociative anesthetic, so it actually has that tendency to propulse people out of their body and have at times ego dissolving experiences. So it happens quite often, which is why actually having support of someone who can do integration with them, with the person experiencing this compound is pretty important, because there were a lot of people doing IV infusions and actually having ego deaths, and they just really didn't know what to do with that experience and needed some integration work. And they were kind of like, well, what do I do now? And so there's actually, I have a theory, is that because of the dissociative part of and the anesthetic property of ketamine, you get out of your body very easily. But when you combine that with the increased neuroplasticity that it offers, when you start to come out of your trip, I feel like a re-embodiment. And I think that creates a bottom-up process that actually allows for being knocked out of dissociation and having a huge amount of insights at the end of the session. And we've actually seen that pretty commonly. People say, well, actually my patient had really cathartic events at the end of the session. And I know I've experienced that myself. So that's one thing I could say about ketamine. As opposed to one thing I just noticed was the beautiful way in which he describes, either going into battle with yourself in these psychedelic journeys, or kind of surrendering to an integrative work of, communication with the various parts of our psyche, right? I know personally, I've definitely experienced both. And, I've had ayahuasca journeys or ketamine journeys, which were very difficult and very conflictual. But working to surrender and listen to those parts of myself, and be open and loving towards all of myself. I think that is the power of psychedelics, and it's changed my life, and it seems like it's really impacted this person's life. So I that's why I think, to your earlier point, the psychedelic effect is pretty tremendous, because in that context, this opportunity for interacting with your own psyche in ways that are difficult in traditional therapy.
I also think this element about, having a good guide, somebody who has enough depth of experience to guide this gracefully, because what we're encountering, the depth of our contact with ourselves in those moments can be terrifying. And I have heard from many people who have tried to, have experiences like, ayahuasca or psilocybin, or now I've forgotten the name of the frog that
5-MeO-DMT.
Sorry, say it again.
5-MeO-DMT.
Yeah, but there's the name of the actual frog that people are getting access to this, and there's a substance. It doesn't matter. Anyways, so there's a frog that people, if they get access to this frog's saliva or something like this, they get access to this substance.
It's 5-MeO-DMT.
So yeah, but I don't know the name of the frog.
Oh,
okay?
the name
It's
of
a
the
frog.
Oh yeah, I know that. I forgot the name of the frog.
So have I. So the idea is that, they'll go into these like very unique experiences, which could be either remarkable and beautiful and transformative, or hugely scary, and leave them feeling cracked and not put back together. I love the fact that, you're opening the door to provide continuity of care with skilled practitioners that are already known, so that the journey can be handled within the context of a known location. I'm not saying that there couldn't be a benefit in the other route. It's just that there have been so many examples that I have now heard of, where things went sideways and were very problematic and left people not integrated. What are your thoughts on that?
I think that's a very important question. By the way, the name of the frog is Bufo.
Oh, thank you so much.
So you bring up a very important point. So first of all, a lot of the people that come to psychedelic assisted or psychedelic integration work, so you're basically touching on integration, right? And psychedelic integration. And there's a number of people who have started to develop this as a practice as psychotherapists, working with people who are, experiencing psychedelics on their own and then need work of integrating them. Of course, most people who come to psychedelic integration have had a difficult experience, because if it was wonderful, you don't really need help, or at least you don't think you need help, at least. I've had difficult experiences with psychedelics. I've had very difficult experiences with psychedelics, and I can comfortably say that having an experienced therapist work with me to make that event a positive one, and get out of the trauma that some of these events can cause. And I'm not saying that all of them can. Like, some events can be very, very incredibly healing. But at times, depending on your condition, I had pretty severe PTSD. My defenses were very high, and I had a hard time sitting through ayahuasca. It was no fault really of the facilitators. I felt pretty traumatized, and working with a trained, mental health professional who helped me make sense of that experience, integrate it. We worked with CAP for almost 3 years together after that, and I was actually able to, understand what was going on and deal with the internal dynamics of my PTSD and heal from that. And actually, I was able to go back to drink ayahuasca not that long ago, and it was an extremely healing experience. I was prepared for it. I had done preparation work with my therapist. I went into the ceremony where we both agreed it would be a good idea, and I came back, and it was a very healing experience. And so I think the dynamic of being able to incorporate trained professionals in that container is hugely important. And then giving them, on top of that, the ability themselves to work with compounds like ketamine with you to have a psychedelic assisted psychotherapy session. And it's important to understand, by the way, I want to point this out. Psychedelic assisted psychotherapy isn't just a ketamine session. Like, psychedelic assisted psychotherapy is comprised of 3 components: preparation. Understanding what preparation means is someone preparing the patient, not just to say, you're going to have these sensations and this is what it's going to feel like, or it's not only working with setting an intention, it's also it's actually, for the most part, mitigating expectations of what one would believe this is going to be, because there's a lot of transference that happens to the medicine itself and to the experience and what they think an experience should look like. And so having a person prepare to mostly really sit with whatever that experience unfolds at that time and take that in, and being able to be present with it, is really what a lot of the preparation work is, right? And then there's the dosing session, where the therapist can either, if they're having a psycholytic dose, which is lower, interact, or if it's psychedelic, they'll go inward and holding space for someone. And then there's the integration work. And the integration work isn't, 5 minutes around the fire where you just say, here's my trip and it was awesome. It's actually like getting in the weeds with somebody over the course of several sessions to say, well, what did this mean to you? And also not interpreting. Like, that's the other part that's hard sometimes for therapists.
I'm gonna unfortunately have to
okay.
stop you, Jonathan.
Okay, that's okay.
And obviously we have to continue this at another conversation.
Yeah.
Because we are wrapping up today. I want to thank everybody for joining us again today. You as well, Jonathan. It's been very enlightening. Thank you so much for what you do.
Oh, thank you.
I know that we'll talk again. You'll hear from me back channel shortly.
Okay,
but
good.
I just want to sign off with everybody and wish you all a gentle day. And thank you so much for joining us again, and be kind to yourself.
Thank you for having me. Thank you for what you do, and thank you for listening.
Bye, Jonathan. Thank
Bye-bye.
you. Bye. Bye, everyone.
Thank you for listening to the Bear Psychology Radio Show with psychologist, author, and speaker, Dr. Anna Baranowski, right here on Reality Radio 101.